Hi, everyone. My name is Joe Kelly. I am the program host with the Community Relations Department at Rochester Hills Public Library, and I'd like to welcome you to this evening's Smart Towns program, The Silver Lining in the Midst of the Pandemic, with Ascension, Providence, Rochester Hospital's Colleen Ellis, NP, Elizabeth Jackson, PA, and Stephanie Bauer of the hospital's Community Health and Education Department. Please join us on Thursday, April 1st, so a little ways away for our next one, but on April 1st at 7 p.m. for another Smart Town program, COVID-19, What Do We Know? With Dr. Mohammed Kaslan, pulmonologist with Ascension Providence Rochester Hospital. And for more about Smart Towns, please visit smarttowns.rhpl.org. And to register for a program, Smart Towns program, visit our website at rhpl.org or calendar.rhpl.org. Tonight, the audience will remain muted throughout the program. And towards the end of the program, you will, throughout the program, you can, if you choose to do so, leave questions in the chat feature. I'll leave a little message so you can all see where that is. And towards the end of the program, we'll turn into a Q&A section where we will just go through our questions and give answers. But I think that about does it for all my info. So without further ado, I am going to go ahead and pass it off to Stephanie Bauer. Stephanie, take it away.
Thanks, Joe. You did a lot of work for me, so thank you. You covered a lot of territory. I truly appreciate it. So thank you so much. This partnership has been such a blessing to us. Working with the library has been such a joy. So Smart Towns is amazing, and we're working hard to get really good programs to you. So this is what I'm excited about, silver lining. We all want to hear about the silver lining to this pandemic, right? So we have two beautiful providers with us tonight who are going to give heartwarming stories and their frontline perspectives. So this is going to be a good program tonight. Again, use that Zoom chat feature. I'm going to be looking at the Zoom chat feature throughout this presentation, gathering up those questions, and I'll read them off at the end of the presentation. So please do that. And let me introduce the two presenters tonight. Elizabeth Jackson, she is a physician assistant, and she works at Ascension Providence Rochester Hospital, and she does a lot of work here. When I was reading her bio, I was like, wow, she's busy. So she's manager of the PA and NP program, and also, or I should say themselves, she's the manager of all of them, and as well as the cardiovascular service line manager. So she's a busy person. She has been worked in a variety of roles for the last 17 years within the inpatient and outpatient settings. She's focuses on cardiology, internal medicine, and observational medicine. She's worked in Detroit and Orlando, and she's been at Ascension Providence Rochester for the last 13 years. So we love Liz. She's fantastic. She got her bachelor's degree at Albion College and her master's degree at Wayne State University. And then Colleen, who's another wonderful person here, she is a nurse practitioner. She's serving patients at Ascension Providence Rochester for 16 years, and she has served in a variety of roles over her career, and she's currently practicing in cardiology, pulmonology, and interventional radiology, another very busy person at the hospital. And she obtained her BSN and Master's of Family Nurse Practitioner degree from Oakland University, so very local. So Liz is going to get us started this evening. Welcome, Liz.
Thank you so much, Stephanie.
Welcome.
Nice, welcome. It's nice to see some familiar faces and familiar names. I'm happy that everyone's here tonight. So I'm going to share my screen here. No, I didn't want that. All right. So we are going to talk about the silver linings in the midst of this pandemic. All right, so I'm starting off with because of COVID. What I said was if I had a nickel every time I heard that phrase, I wouldn't be here. We'd be on our private island sipping margaritas on our own. But no, COVID has been such a whirlwind. There have been lots of pain and grief and an emotional roller coaster, really. And tonight we don't want to downplay any of the profound impacts that COVID has had on families and on frontline workers, on stay-at-home workers, on kids, on the elderly. It's been, a very emotional experience and a stressful experience. And we've witnessed this, trauma and stress firsthand. We also understand like the economic effects and small business concerns and even the division it's created. And there's like no disrespect to what we've gone through, but tonight we're kind of flipping that switch and trying to focus on some of the silver linings that we have seen, especially as our work and as, healthcare workers at Ascension, Providence, Rochester. So, of course, I want to pull out some of my favorite memes that you saw from 2020. I think dumpster fire had been said over and over again. Can we reset 2020? You see Oprah here starting off in January and ending in September. And so, we know that 2020 has been a rough year, but I also found some great memes just to kind of flip the switch here. Who doesn't love Bob, the painter? You need the dark in order to show the light. Pro tip, you should wash your hands even when there isn't a global pandemic. And good morning, we're not stuck at home, we're safe at home. When we change our thinking, everything changes. The world is closed for renovation and grand reopening soon. And you've mastered survival, now it's time to live. So that's just a little introduction of kind of what our focus is on tonight. And Colleen's going to talk a little bit first about some of her personal experiences as one of our star frontline workers. I'm not going to lie, Colleen has stepped up and has been one of our go-to nurse practitioners. Every day she is willing to do whatever it takes to help these patients. And I'm so thankful to be sitting by her today and letting her, be here to share part of her story. I hope, is everybody seeing there we go. Okay.
Thank you, Liz.
So here is Colleen.
Thank you for everybody for taking the time to listen to our stories, because it's nice to share it and kind of explain what we've been through and on the growth that we've seen over the past year. Almost it's 1 year anniversary to the day, I believe. So Ascension, I was born there. I had both my kids there. I've been there for 16 years. So Ascension, aka Crittenton, I will call it, it's an extension of my home. So when this pandemic hit, it hit me in my own house as well as my work home. So that was a huge shift, a dramatic shift overnight. But what it's nice to see how we adapted as a hospital professionally, colleagues, and how we changed. So I categorized everything I could as best as I could. And I used the word H, or the letter H, excuse me. I categorized everything to how it affected our home, health, habits, hours, and our hearts. So if you don't mind, I'd like to go and share that a little bit. I want to start with home. Home for me is a definition because like I said, I've been at Crittenton for 16 years. My friends, my family, and it's my home life. But never before have we been granted so much time to our home life. So for me, it allowed a rebirth of so many connections. I was able to connect with family, cousins from California I haven't seen in years. Well, as takeout, I can tell you, we tried every takeout restaurant in Lake Orion possible because we were supporting local. We were able to spend time with our neighbors who we never thought we'd otherwise spend because we're at home more. So we're very blessed, and I'm very blessed to have a great neighborhood and support system. And I think one of the main points I want to be is our home improvements. We now finally had the time in our life to focus on that home project that we've been aiming to do our entire life. Mine was gardening. I really was set on making my home with a beautiful garden.
Oops. Oh my gosh, hold on.
I'd like to share with you the before.
Hold on. I'm trying to get my messages off here. Okay, quick pause. I'm getting back to there we go.
So the next page, how do I go to the next? This next slide is my goal for what my garden was supposed to look like. And then I will share with you the reality of my garden. How do I see the next? So that was the reality of my gardening situation. So clearly I will stick to healthcare in this role because I don't have much luck with that. Then, is it this button right here?
Yep.
Okay. So next is healthier practices, I felt. Washing our hands more frequently, masking up, social distancing, sanitizing, healthier practices. Basically, as healthcare, we always focus on standard precautions. However, now everyone does it, and that's led to so much more changes in habit. I'm so proud of the fact my 4-year-old will sing happy birthday every time he washes his hands. So good for the school that he goes to, and good for us for washing our hands.
I also just want to add, as a manager working in some leadership roles in the hospital, in the past, you have seen that people have come to work sick because we are healthcare workers and we plow through whatever we need to. Also, people, used to send their kids, like, here's some Tylenol and send them off to school, even with, runny noses and maybe a fever that morning. And I think that this has really been an eye-opener that we should really be proactive in trying to protect others. We shouldn't be going to work sick. We shouldn't be sending our kids to school sick. And I've noticed, a really nice change in that people are more respectful of being around others when they aren't feeling well. So it's a practice that probably needed to change before, but now we actually are doing it. So yeah,
very, and to practice our social.
Yes.
That is, hopefully CPS is not on this, but that's my daughter practicing safe distancing and sanitary
yeah.
So kind of like adding our habits then, we did necessity is indeed the mother of invention. So I was able to do new habits like my gardening. And at the same time, we were we went for the first time RVing. I've never done that before. We were saving a lot of money on gasoline with traveling to and from my husband for work, reducing carbon emissions, lowering commuting costs. We were able to do that. And this is our first RVing experience. And that's also our first attempt on my son's haircut.
Yeah.
So I'm not meant to be a gardener or a hairstylist, I have to consider. So, and then we'd also going on the habit is we were trying new business practices, and it was our first time eating an igloo. It's my family at the igloo in Clarkston and Honcho. So it's always fun. And then proceeding hours. So we have spent long time hours in places we have never thought. One home, for our case, it was a lot more hours spent at work. So it gave us a lot of time for more self-reflection, self-improvement, hobbies, so on and so forth.
Yeah, and I think that this is where a lot of families kind of learned a lot of new ways to entertain themselves. There's lots of Trivial Pursuit that was done. I've heard a lot of people of just now knowing about parks in their area that they had never experienced before, because they kind of had to push outside their comfort zone of just, their normal going to soccer here and this practice and violin practice. And there was a lot of new hours to fill. And so I think a lot of people around our area got to experience, the beauty of just the area that we live in. And yeah, there's some fun new hobbies, right?
Here's an example. We did a St. Patrick's Day parade.
On your own.
On our own. This is the Ellis family, as well as a Zoom meeting. I will point out Liz Jackson in the bottom left corner.
Yes.
So we were able to have times and learn more, make hours out of fun out of the hours that we've had time at home.
Right. Zoom book clubs ended up being actually a really fun thing. So
yes.
We transitioned and pivot.
And also, most importantly, it gave us time for rest. This is our dog resting. That's his spot on the couch. So that's what I did appreciate too, is sometimes we're forced to rest, and this was a good opportunity to do that for us.
Yeah, I think a lot of us have gotten into this world of like go, 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 to-do list, and always adding on the next activity. And this was a time of kind of forced, take a step back and really look at what's going on in your life, and maybe some forced relaxation. Maybe it wasn't relaxing, but maybe forced slowing down and that sort of thing. So, yeah, here's a nice puppy
of rest,
showing his rest.
That's how we should all be resting.
Yes. So now we're going to end with kind of the heart of the matter. So we're going to transition a little bit to what we saw in the hospital setting. So in the hospital, there's Dr. Wisman actually. So there was a really big shift in the hospital in March. We had gone from working, we have our ortho department and our cardio department and our trauma department. We have our resident team, our FM, which is family medicine, and we have internal medicine, we have physician assistants, PAs, we have house doctors. And literally at that time, the focus it wasn't on your departments. It suddenly became one team. And this was actually the room that we would meet every day and kind of have our game plan for the day. So we had our chief medical officer there. We had primary care physicians from the community coming in to help. We had resident people that had gone through our residency that actually came back to help. And it was an amazing thing to see this team just suddenly come together, and the teamwork was amazing. And one of our nurses ended up making us these shirts too. It says, "Some superheroes wear capes, we wear masks." So it was just, it's hard to really explain the impact, but this has now continued on. The residents, and the physician assistants and the nurse practitioners now have become a team. And instead of us going back to our separate groups, we have continued on this team mentality and support. And it's been, one really positive change that's happened, that there's a lot of community felt in the hospital and teamwork.
The teamwork was tremendous.
So the other thing is we have a great partnership with Rochester Hills in Rochester, and the fire department, the police department, our EMS, first responders. And this was just one of the pictures of when they did their parade around our hospital, and we, sirens and cheering. And it was just another really nice visual of seeing a great community come together and support each other. And it was a crazy time and a tough time. And sometimes you felt like, is this really real life? But having all the support from all of these team members coming together really made it, a difference.
We felt we weren't alone.
Yep. The other thing is our community is an amazing community. I'm not going to be able to name everyone here, but the elementary schools immediately stepped up. Musson and Longmeadow and McGregor, some of the local elementary schools, as soon as the school shut down, the next week they were there delivering, all their extra antibacterial wipes, the hand sanitizers. They were pivoting quickly to just show their support in any way that they could. And that's actually my kid's art teacher. So that was really fun to see a familiar face too.
And our lab goggles came from
Rochester
High School.
Yeah, we had some goggles donated.
Which were very critical.
And this is Hart Middle School showed their support. They signed this huge banner. And it's just heartwarming to see, 6th graders, 7th graders, 8th graders showing their support to the teams at the hospital. The other amazing thing is the amount of teenagers and our youth that stepped up during this time truly warms my heart. We have an amazing generation of kids coming behind us, and I am so proud of what we saw during this last year. We, from Adams High School, Grace Yang organized notes being delivered as words of encouragement to our staff, and she was from the DECA group. We had Christmas cards that were dropped off for the patients from the National Honor Society. Rochester High School, one of the students started a nonprofit called Rebuild Rochester, and they wrote notes to staff, and they donated money to give to the caregiver fund. The West Middle School students, they sent their artwork, and then it was delivered on the patient trays just to give a little bit of a personal touch when a lot of the patients are feeling pretty isolated. Notre Dame prep student has worked on our garden that's on our 2nd floor by our cafeteria, and all the vegetables he grew last summer were then donated to the food bank at the Rochester House. Holy Family Girl Scout cookies were coming all the time. It's amazing that we're not, at least 50 pounds heavier actually with all the
just 19.
Yeah. Stony Creek High School, they raised money to donate meals, and they donate to our OR. And this is literally just like one little snapshot of that happened. This is
yes.
and I just wanted to kind of call out some of our teenage groups that really went above and beyond and did whatever they could, to show their support. And here are some pictures. I mean, these kids are amazing. We have, our kid, this is our guy from Notre Dame Prep, and he's watering the garden up there. This is from Rochester High School. They started their nonprofit. I also wanted to talk a little bit about the ripple effect. And the ripple effect is, I always try to teach this to the kids, like one smile when you're passing somebody in the hall can then lead to one person feeling a little bit better, and they might say something nice to somebody, which then they say something nice, and just your one smile can end up rippling out and affecting so many. There was a student named Lexi Powers. She's from OU, and she's also a front desk volunteer. She donated on her own birthday, she donated iPads to the hospital. Initially, the iPads were used for families to communicate with their loved ones during the times of isolation, which was emotional to say the least. I mean, this was a tough time when people are in isolation. There was no visitors allowed, and these iPads really did provide that communication, and you could see, face-to-face patients to families. We also had a team that would go around to organize this, and those iPads, I mean, it was a huge donation, but I don't know if she truly understands like the effect that had and how many families were able to connect with their patients.
Very gracious.
Because of how many more, iPads we were given. Now, the interesting thing, as we have had less cases and the visitor restrictions are a little bit, less restricted, we have transitioned the use of our iPads now for our heart failure patients. And some of our cardiac rehab patients, we are using these iPads to now create visual appointments. So here's one of our heart failure or virtual appointments. So some of these patients have a really hard time leaving their houses, or they don't, want to come to cardiac rehab. So now we can use these iPads to have our virtual platform so we can connect with them still when they're at home, and still able to try to keep them heart healthy in the meantime. So I don't know if she realized sometimes that this one birthday, donation that she gave has now affected so many people.
Given tenfold
at least. The other thing is, from a personal story, this is a lot of the group of PAs and NPs, and I play on a Great Lakes women's soccer team in the summer, and they usually do a fundraiser. And this year, instead of doing a dinner fundraiser, they did a small fundraiser, and they donated lunch to the group that had been working on the front lines. So because we had brought this big group together for a lunch, we then in turn turned it into one of our own charities where we make care packs. So because we had brought everyone together, we then decided, we're going to use this opportunity now that we're together and put together care packs, which are packs for the homeless, that if you see homeless, it has a list of resources and some toiletries and needs that you can give them as you see people in need on the side of the road or in front of stores and that sort of thing. So we ended up making over 170 more care packs during that time. So, the soccer team that I played for that then decided to donate us this lunch then turned into, connecting with 170 more, or making 170 more care packs. So you never know how that one act of kindness is going to keep, it going. I tried to get a list. So here's a list of all the people who donated the wipes, the sanitizers, the food, the gloves, the goggles. Our Rochester community was amazing, like the Rochester
Yes.
Junior Women's Club. the DDA. I mean, the list goes on and on. Beyond Juice and Tropical Smoothie Cafe. It is truly amazing. And this was just in March. Like, I couldn't even fit the ones from April, May, June. So, and then we had generous donors. These are the Sheltons who have really donated a lot to our heart center. They brought in a nice lunch for everyone. And so it was just a truly amazing community effort. And we did feel the love. And I know we're really lucky. We work at a beautiful hospital that's supported by the community. And we just wanted to show how amazing this community is and how loved we felt, even during a really, really hard time. It was definitely a bright spot. I'm going to show a video, just kind of a compilation of what we, this is kind of a compilation of the very beginning, from March until in the very beginning of it. And it has a lot of our PAs in it.
We'll pick our battles cause we know we're gonna win the war. We're not rattled cause we shouted all of this before. Steadier than steel cause we're ready with a shield and sword. Back on the saddle cause we've gathered all the strength for more. And we won't bow, we won't break. No, I'm not afraid to do whatever it takes. We'll never bow, we'll never break. Cause we are warriors, we'll fight for our lives like soldiers. On through the night and we won't give up. We will survive, we are warriors. And we're stronger, that's why we're alive. We will conquer, time after time, we'll never falter. We will survive, we are warriors. We are warriors. Like Vikings, we'll be fighting through the day and night. We'll be marching through the darkness till the morning light. Even when it's harder, like the army, you will see us shine. No, we won't stop and we won't drop until the victory's ours. No, we won't bow, we won't break. No, we're not afraid to do whatever it takes. We'll never bow, we'll never break. Cause we are warriors, we'll fight for our lives like soldiers. On through the night and we won't give up. We will survive, we are warriors. And we're stronger, that's why we're alive. We will conquer, time after time, we'll never falter. We will survive, we are warriors. You can't shoot us down, you can't stop us now. We got our army, you can't break us down, you can't take us out. This will be behind us. Warriors will fight for our lives like soldiers. All through the night and we won't give up. We will survive, we are warriors.
Brings back memories.
I know.
That's a nice snapshot of quick year.
So just kind of in closing, we actually got a really nice message today from Joe and PJ. He's the head of Ascension, and I'm using some of his words because it was a pretty powerful message that they sent, but that he sent. So it was 1 year ago, which is so crazy because when we picked this date, I didn't even realize it was exactly 1 year ago when the World Health Organization declared COVID-19 pandemic. And at that time, no one could truly foresee the impact on our hospitals, our nations, our world, our families, our kids, our elderly, our healthcare workers, our frontline workers. No one knew, you know. And Pope Francis speaks of creative courage. He says, in the face of difficulty, we can either give up and walk away or somehow engage with it. At times, difficulties bring out resources we did not ever think we had. And I think Colleen did a great job of showing that some of, you know, the pivots that we had to make with the RV and art-filled attempts at gardening and stuff like that. And here, this is a poem, and it's the end of the poem that says, when this is over, it closes with these words. When this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hope to be, and may we stay that way, better for each other because of the worst. And this is just a funny to end. One of our COVID swabbers just sent that to me. So thank you guys for being here tonight. It was awesome to see everybody in the crowd, and we, you know.
And the support from Rochester is an opportunity for us to show our gratitude. I feel just how lucky we are to be in a good community, and how I've never seen the outreach we've had before, the support. We're all thrown in positions we never knew we would be in.
Yeah.
But to know that you're secure in support from your community, family, friends, it's reassuring and
absolutely
invaluable.
Thank you, ladies. Thank you. This is great. And man, I was laughing. I know you couldn't hear me because I muted myself, but there's, I love that last slide. So, you know, I'm a lactation consultant too, and I work with a lot of, you know, moms, new moms, dads, and there's been some silver linings in that, you know, in that group of people, just because a lot of partners are home, right? They're working remotely. So these families have more, the moms have a little bit more support. Now maybe it's a little bit different, but a lot of families have been enjoying the fact that they're together. And be honest, a lot of families have been enjoying the fact that there's no visitors, because they get to have this one-on-one time. And that's not to say that visitors aren't, you know, missed, but there's a silver lining to that one-on-one time with their new baby. And so I would say that's an unexpected silver lining in all of this, to have that partner home for maybe a little bit longer and to have that support a little bit different, but it's been beautiful still.
Yeah, absolutely. I also always joke, I was joking with Colleen today, another silver lining is that the kids, these elementary school kids, are going to be very tech savvy and know they understand how to mute themselves better than still people at work do. The 8-year-olds and 9-year-olds. So they are, it's amazing how adaptable they are. And I know it's been, you know, there's been a lot of mental strife and a lot of issues. It's hard to be staying home and transitioning, but some of the lessons they've learned about adaptability and, you know, even just this virtual world, they're gonna be well equipped.
I agree. I agree.
Mm-hmm.
Adaptive.
Yeah.
For sure. So do either of you want to express more of what has changed in your role as a provider as a result of the pandemic? Do either of you feel like there's been a change in your role? I mean, it sounds like you're just doing more, but.
Yeah.
I mean, so? I would like to say living science. It's the first time patients are living science one-on-one with us. Mm-hmm. You know, information came out day by day, and we were learning just as the patients were at times. So talking to people, especially when the vaccine started to roll out, is what do you expect? Well, this is what we have science. Science has done its job, and we're learning as you are. So we're learning as to how to take care of you. Your patients are becoming more independent, thinking that they may have COVID. They now are responsible, stay home and can manage, as well as virtual. Before, a virtual visit sounded to me very Jetsons, but now it's very normal and very common to see and assess, listen to symptoms, and treat patients that way. So it's been a dramatic shift for me. Coming from a cardiology pulmonary, I more jumped back into the pulmonary, and it's changed, it's evolved, and we're learning as everyone else does too.
Right.
I would agree with all of that. And I also, had mentioned it, but the connections we made while we were kind of thrown into these teams, we still just, I think we've grown together, and I still feel like all reaching out to the residents and the pulmonologists now, and we're all one big team instead of feeling a little bit isolated from those different groups. So that's been that's been a great change, actually.
Yeah, that's a change you want to stay, right?
Exactly.
That's one of those major changes that has been really neat to see. So do either of you want to share about, hospital care during the pandemic, something that people should know now? I think it's still a little bit of a scary thing to come to the hospital. Is there anything you could say to help ease people's minds? And
yeah, I mean, I think, like Colleen said, we're actually still learning every day. I mean, but I would say now there is a comfort level with our PPE. We have enough PPE to be able to treat all these patients safely. We have a better understanding of just the treatment overall of these patients. So we see less patients that are in the ICU and more patients maybe just on the medical floors.
right.
And right now, actually, the prevalence in the community has been trending down in a good direction. And so our visitor restrictions are actually at the next level now, so that people that are not on COVID units can have one visitor. Well, before that was pretty restricted. So
Right.
I think Lane's coming back. It's definitely moving in the right direction, and there's more understanding of the disease process, and then we also feel well equipped. We have the right PPE, like I said, equipment and PPE and medications, and it's a little bit more of a comfortable thing now compared to before, where it was just a new adventure every day.
Right.
The vaccine rollout has been, I feel, pretty steady in that I have to say a majority, if not all, the people I work with are vaccinated, and that's a security blanket too.
Yeah, it's
staff is.
Exactly. We're making positive strides in the right direction.
Yeah, and and I do say, working at Ascension, obviously the vaccine was available to all the workers there, but also we're continuing to screen ourselves every time we come in. Like you say, we're not coming in sick. We're still masking despite that when we're in the work setting, and so ultimately I think we're still taking a lot of the precautions.
Yeah, absolutely. There's very good screening protocols. We as associates or employees, you have to fill out your app every day to tell if you're having symptoms or not. Everybody gets temperature screened. So yeah, there's still great protocols in place. We're not really putting down our walls. It's just that we're, the cases are trending in mostly the right direction. So.
Right.
Practicing CDC guidelines right now. We're both vaccinated.
Yeah.
So now we always did follow the CDC guidelines, but now new regulation is 2 people are vaccinated, then masks. We still highly recommend it, but now it's a nice security feeling that we're both immune.
Yeah, it's a sign that things are starting to move in that direction. Which is,
yes. To be in the same room without a mask.
Yes. And it's just, we can see people smiling with their eyes oftentimes, right? But it's nice to see them when you can see the complete smile in people's faces. So, and I know that I've learned a lot more about technology than I've ever, and just this Zoom and Google Meet and all that we're doing has been it's been a good year of growth for me as well. So,
yeah.
So I want to read this. I haven't had any questions come in, but Mary Reynolds says, and you guys can probably see it, when I wash my hands, I say a 20-second prayer for the world instead of merely counting. I am hoping I am helping others as I help myself. I will now especially include healthcare workers.
Oh, I love that.
Isn't that beautiful?
Yeah.
So yeah, a lot of beautiful, supportive comments have come through over this year. It's just, people are just, my heart grows all the time hearing what people have to say and the encouraging words. It's been beautiful. All right, so here comes a question. Besides proper hand washing and staying home when sick, are there any other medical lessons that became more commonly known during the pandemic that you hope sticks around even after the pandemic dies down?
The business more standard precautions really got reinforced. The hand washing. I had put in my habits, vampire sneezing into your.
Oh yeah.
It's nice to see my 4-year-old, my toddler, following those guidelines too, because they're so reinforced. And kind of going off what Liz had mentioned earlier is if you're sick, you stay home, and people understand that, and they're grateful that you're honest and say, I don't feel well and thanks for protecting me and staying home and doing the right thing. I think there's been a lot, that's been the biggest change I feel too. It's we don't buck it up. We understand that our body's sick. We need to do the responsible thing and stay home. So
Right. I'm sure there are other things, Joe, because I think Joe sent that question.
Yeah, those are still the major things. It's interesting, with the mask wearing right now, the amount of flu has actually dramatically lessened this year compared to years past. And the epidemiologists and infectious disease docs are feeling like it's probably related to the mask wearing, is that the flu is not spreading. I don't know if mask wearing is going to be here forever and ever, but I do think that has definitely affected our flu season this year, because it is dramatically down compared to where it has been in years past.
Right.
That was definitely on my mind when I asked the question, because I know there are a lot of places where it's a little more common to wear them, like just for like the cold and flu and stuff. So I do wonder if there are going to be maybe some people that might grab one, at least when they're feeling sick.
I agree. I don't think it's a bad idea, and clearly it's helped reduce the spread of, especially other things besides COVID, like the flu. So it may be a practice that sticks around.
I don't know about you guys. My kids are a little bit older, but they've been playing more outside.
Mm-hmm.
And so we've been doing just a lot more outside, getting fresh air. And I just feel like that's been a healthy change in our household for sure.
I agree. And so our kids have been outside so much, even during the cold. It was like, well, if you want to play, with the other neighbors, then they're playing outside in the snow. And the other thing is because I think because the activity slowed down, that we were one of those, like, going from after school to soccer to volleyball to pick up from Boy Scouts. And since a lot of those things had slowed down or maybe are on Zoom right now, they actually have time to just play outside and ride their bike and actually imagine and play. And I think to me that was actually a really big eye opener to say, you know what, maybe we do need to reevaluate. Like, is this good going from activity to activity to activity? Maybe we need to have some slow down and play. Yeah. But I agree, the outdoor, we walked the trails, we found nature centers that we never knew existed. We found so many of these rocks. Have you people are painting rocks, and I think it's called Michigan rocks or something, or South, and it's so fun. So now my kids paint them and we hide them at Innovation Hills, and it just, I think there's a lot of creativity happening that, we might not have had the chance before, or, made ourselves have that chance.
Right, for sure. For sure. I have seen those rocks, and they're just a little bit of joy on your walk, right?
Yeah.
Very sweet. Very sweet. So. Well, let's see if any more questions came in. I don't think anybody did. It's your last chance, people. Put in a question. But thank you both so much. This was fun tonight. This was really neat to see. I didn't, being at the hospital, I didn't even know all that was happening. So it was really neat to see that, and very encouraging that through this tough time, the hospital in our community really came together, and I think grew in beautiful ways. So it's neat to see that.
Yes, how we've evolved.
Yes, but thank you so much for having us tonight.
Yes.
It was great.
Absolutely.
And we appreciate all you guys coming in to listen in.
For sure.
Absolutely.
Thank you.
And Joe, you're gonna we're recording tonight, so this will be available to share
Mhm.
in about a week or so, right?
Yes, about a week from tonight. The
All right.
program that we did with you guys last week also just went up today. So feel free to check out that one. It was on preventing colon cancer. And our next program that we do in April coming up will also be uploaded once that is recorded.
Perfect. All right. Well, thank you both so much. This was a joy to
Thank you so much.
Thank you.
and I know our community will enjoy it as well. And that's the neat thing about recording these. We can definitely share it for more people, get the word out, and we'll share. Even more people will be able to join and see it too. So
Absolutely.
good night, everybody.
Thank you for joining us. Good night,
Take
everyone.
care.
Good night.